attacking my hand right now, so sorry. And he's a big cat, so and he's just a kitten. Anyway, welcome everybody. This week we have Dr. Erica Halla. How are you?
I'm doing great, thanks.
I
I see some ears.
Yeah, he's a big boy. He was my little one that almost died. He went into hypoglycemia when he was a couple of days old, and I had a real hard time pulling him out of it. And now he's ginormous, and I'm like, oh my gosh! But he's just the sweetest kitty. But he's going to probably grace us a little bit here today. I always say this when you come on. Your energy is just so amazing. So when I see your name come up on my list of vets I recommend, I know there's going to be some good energy floating around. So it's just great to have you here, and so willing and free with your time to come and help all of our listeners and answer questions. So just thank you so much for doing that for us. It's hard right now. Vets are overworked and busy, and people can't get into their veterinarians, and the vet hospitals or the emergency room hospitals, right? They're taking on so much. So I think knowing that that's going on, it's even just more amazing to me that you guys are giving up your time to kind of maybe answer a couple questions for people and sit on here and help if you can in any way, knowing how busy you guys are, because you guys are just inundated.
Absolutely. Yeah. Oh my gosh, it's crazy what's happening in the veterinary industry right now.
Yeah. What do you think? What do you think is? I know we're gonna talk a little bit about 4th of July. We said in a couple of things, but what do you think's going on? What do you think is causing all these problems? I mean, I know it's probably
Oh
not
my goodness.
but it is really bad.
Yes. So I could talk about this for hours, actually. This has been a pet peeve of mine since I became a veterinarian. So that was 12 years ago. And this problem is something that the veterinary industry was already having involved conversations about while I was in vet school. That means that the powers that be, the AVMA, the American Veterinary Medical Association, and vet schools and everybody in the industry has known that this problem has been coming for close to 20 years. And there were some really serious conversations going on when I was in vet school about shortages that were already happening in large animal medicine, food animal medicine, um, and about coming shortages in small animal medicine, and discussions of solutions and things like that. But like with most things, solutions got discussed, nothing got done. And now here we are. COVID exacerbated the situation with a whole bunch of people adopting a whole bunch of pets all at once. And the system that, unfortunately, very like the human healthcare system, the system that was overstressed before then is now just crumbling apart. And of course, we have an epidemic of veterinary suicides for this and related issues that is now worsening. It's been bad for a while, but it's worsening now. And that, again, that takes more veterinarians away from us. That makes our attrition much faster than it was predicted to be, should have been. And I think in the last 5 years, there's been maybe one vet school in North America that's been added. And a few schools have increased their class size slightly, but we're not replacing ourselves fast enough. It's a whole problem that's been many years in the making. And yeah, I could talk about it for hours, but it might not be the most useful topic.
It actually, it really is. I think oop, I lost you guys. Hold on. I just pushed something. I was trying to turn my volume up. Sorry. I lost my screen. I think people need to understand what's happening, because if you have an animal and you don't realize what's going on around you, you call to make an appointment and you're like, what do you mean I can't get my dog in for 6 months? Or what's happening here, they won't even take you if you're a new client. So you
Exactly.
can't even get in unless you have an established, care there. And if you don't, you're left to go to the emergency rooms, and then the emergency rooms are taking on things that are not considered emergency, which is then causing animals that are in emergency state to die. And I'm not saying that I think they are. I know they are.
Yeah, and emergency clinics still do operate with triage in the veterinary world. So part of the problem is If you're there with someone who's got a bladder infection, because your regular vet can't see you for 4 weeks, which is way too long to wait with a bladder infection, and there are a bunch of other dogs coming in who are having trouble breathing, been hit by cars, whatever actual emergencies,
Yeah.
those ones get taken care of first. You might wait 5-10 hours, or you might not get seen at all with that bladder infection for days, even going through the emergency system. It's really, I know it's particularly bad here in the Willamette Valley in Oregon, but I also know that the rest of the US, likely, I don't know a bunch about Canada right now, but likely the rest of North America is not in very different situations than we are.
Right.
And it's a real challenge. I mean, I've been closed to new clients other than some intermittent additions here and there for 3 or 4 years now. Um, and of course, my clients still need urgent care because I often can't get them in right away if there's something like a bladder infection or a super terrible ear infection or something else. So when my clients have to use the emergency system, I learn about just how bad it is right now. And it's really bad. It's
Yeah.
really bad.
It's so bad here in Orange County that the triage that we're all kind of familiar with, if you've ever been to a human emergency room, right? There's always a nurse sitting there. They take your temperature, they do your kind of vitals, and then assess the situation. And I know that does go on in the emergency veterinary world, but I just had a good client of mine whose dog has dilated cardiomyopathy, and her dog was kind of going into respiratory distress, and she called 2 emergency rooms and they told her, don't even come. And I thought,
Yeah.
this is an animal that's going to die if we don't get her in somewhere. And so
Mhm.
they said they were 5 hours booked out, 5 hours. But to me, that's not really like taking the most dire, important animal
Well,
first.
who knows? Because
I
who
know.
knows what's there? It's the same situation we had when COVID was super bad and emergency rooms were overrun with COVID patients. If you had a broken leg, you might be waiting half a day to be seen because there were all these people in respiratory distress. And if there were so many people in respiratory distress that you show up in respiratory distress, but there's no bed for you, there's nothing, then they turn you away. And that does mean that whoever in the situation we're talking about, whether it's humans or dogs or cats, whoever you are, when you get turned away, you do likely die because of lack of care, which is a wild thing to have happening in a place that is supposed to be a developed country, but
Right.
it is happening. It happened here with humans not so long ago, and it's happening here with pets right now. And our healthcare system, our healthcare infrastructure as a whole is just so overstressed. And
Yeah.
it's been coming for a long time. Again, with both situations, COVID made it worse. It made the cracks in the system turn into big pieces crumbling. But this has been happening for a long time, and we all in the industry have known about it. And individually, as general practitioners, there's not much that we can do about it. But our lobbying organizations like the AVMA and the AMA, they haven't been doing very much about it either, which means the government hasn't been doing anything about it, which means, nothing has been done. And so here we are.
Yeah.
Yeah, there are so many people like myself who have been trying to hire associate veterinarians for years. Because I'm looking for a holistic vet, I'm in a bit more of a unique
Right.
situation, but I have been looking for 6 years now and had basically no success. And I know that right now and for the past couple of years, the situation is the same with traditional practices, with conventional practices. Unless you're giant and corporate and can pay a bunch of sign-on bonuses, then you don't get anybody, which means that as a result of this problem, our veterinary medicine is starting to shift more towards corporate medicine because they're the only people who can get doctors. So
Yeah.
it's a huge problem that is about to become worse, unfortunately, but that's just kind of where things are.
It is. It's absolutely. I know the state of California only has I mean, we're a huge state. We have 2 veterinary schools. And you think about how long it takes to get through school. I mean, how many students can they even accept? Right. Which is why it was
Mhm.
always so hard to get into veterinarian school, which is why I applaud you guys, because I know exactly how hard it is. That's why I'm not there. But it was so competitive to get into veterinarian school because it just there's not enough schools, and I think it's great to be hard to get in. We obviously don't want people who aren't serious about it, but that poses this problem that we have. Now we don't have enough
Exactly.
veterinarians. And then the veterinarians that we do have are forced to sign on into the corporate, which is what you're talking about. And
Yep.
to me, corporations are not providing good medical care. They're providing
Yeah.
a lot more than good medical care that we don't want. So it's just such an awful, awful, awful situation, which is why I do what I do. And I appreciate so much that you guys come on, because if there's anything we can do to help you be able to do something on your own, possibly, right? Which a
Yes.
lot of times we can if we knew. A lot of times we
Hmm.
can help our own animals if we just knew how to do it. Not always. Of course, we need testing and diagnostics sometimes. But back when I was a vet tech, I mean, there's a lot of things, right, that you wish
Oh,
you could
yeah.
tell your client, you could have done this at home, girl. You
Yeah.
could.
Yeah.
But the fear, which is why I'm hoping and leading into what I want to talk about, hopefully people are going to come on and not be shy and ask some questions, but it's okay if you don't, because let's talk a little bit about what we can do about 4th of July, right? Because you're not going to be able to, I promise you, if you don't already have an appointment, you're not getting in by 4th of July. You're not going to get in July 5th when there's a big blowout of diarrhea in your house on July 5th. So let's talk a little bit about what happens, and let me ask you this. Do you think that if your dog didn't have a problem with the 4th of July last year, he won't have a problem this year?
Oh, that's such a good question. And like most good questions, the answer is it depends. And
Yeah.
most of the time, the answer is yeah, if they were fine last year, my dog, I was so blessed. The first 4th of July, I had this very high strung, very like anxious fire constitution dog. I was like, oh, this is going to be just hell.
Hell.
He was born in the spring, so he was quite young at his first 4th of July. And he just didn't care at all. He just did not bat an eyelash. And that's how he was the rest of his life. Never cared about fireworks, thunderstorms, nothing. So, noise phobia is this very particular kind of phobia. And if last year your dog had zero problem with 4th of July, like none, no anxiety whatsoever, just totally chill. And in the time since then, there have been no significant noise trauma events like every thunderstorm, every garbage can lid crash, all of that. There's been no startling. Your dog's been completely fine. Then chances are good they'll be fine this year. It's always good to be prepared, but chances are good unless your neighborhood is very different this year than it was last year,
Some
which,
of them
yeah,
are
that's sometimes the
sad.
case. Yeah. Then they should be fine. But if they were slightly nervous before, or there's been a noise trigger since like a thunderstorm that was really bad that they freaked out about or something like that, then there's a good chance that this year 4th of July will be different because now they've had that kind of noise trauma, and obviously 4th of July is a lot of noise.
Yeah.
So it's never a guarantee, but if they have a good history and are generally chill with noises, then I wouldn't expect any problems.
Yeah. I bring that up. Hi, Billy. I brought it up because sometimes, and I experienced that with my own. I had a golden retriever years ago. Every year for her whole life, she was fine. And then I probably wasn't paying attention that there was little triggers that were happening leading
Mm,
up to it, like you say, like little triggers. But and I know this is for me too, as I get older, my ears are far more sensitive than they used to be.
mhm.
And because our dogs age so rapidly. So literally the year before, she sat and watched an entire fireworks show with me, no problems. And then the next year, all hell broke loose. Like she was a whole different dog. And from there on out, she had a problem. And I wanted to bring that up for our listeners to, like you say, be prepared just in case. But you make such a good point. If, you know, you go and you drop a trash can or something and they respond to it, then, and they never did before, you might have little triggers that are starting to happen. And you don't want to find out at 9 o'clock at night on 4th of July
Yeah,
that,
definitely
because
not.
it's bad. Have you seen any really, have you seen
Oh,
any really awful cases that you remember at all?
yeah. So I've had a number of patients because I deal with so many behavioral cases who
Yeah.
have noise phobia. And obviously 4th of July is a pretty bad time for them. But my own cat, who thankfully, thankfully he's not with us anymore to experience the 4th of July and be terrorized by it. But
Right.
yeah, the poor little guy, everything I tried, and I never tried pharmaceuticals to sedate him, but everything I tried just never really helped him. He would go to the room that was in the middle of the house, which in the place we were at when we had loud fireworks, that was the laundry room slash bathroom, and he would go behind the washing machine and just kind of cower there all day on the 4th, usually all day on the 3rd and the 5th too, depending on what was going on in the neighborhood. But yeah, it's just, oh, I feel so bad for those little guys. And for all of you out there who do have animals like that, I feel so bad for you as well, because I know what it's like to sit there and watch your baby feel like this, and you know what's happening is not horrible. The sky is not falling. Everything is okay. It's just loud and disturbing. But they don't know that, and they feel like for every minute of those 3, 4, 5, depending on your neighborhood days, they feel like they are imminently going to die. And obviously, that's not a fun place for anybody to be.
Yeah. It's so awful that back when I was more involved in veterinary medicine, there we we were in an area where there was so much fireworks that we would get dogs that literally, they're, when you say they think the sky is falling and things are that bad, they will go through windows because they think it's in
Mm-hmm.
the house. They don't know what's happening. And so I have seen dogs come in just bleeding. So it's not to scare people. It's that I really want you guys to be prepared for this 4th of July if you live in an area where there's fireworks. And it usually starts a couple of days before, right? And then you have the day of,
Yeah.
you have even the day after, and what do you do? So let's talk a little bit about some of the things that you think might help these 4th of July guys. And real quick, before we get into this, I just want all of our listeners to know, if you have a question that isn't to do with 4th of July, just throw it out. We can stop and continue and go on. So this is your time. If you have questions, just go ahead and shout out. Dr. Hala is so kind to be here to help answer it. But what do you think, like, what have you seen work for animals?
So I have had some success with the Herb Smith formula, July
July
the
4th.
3rd, I think they call it.
Oh, is it? Oh, it might be.
Yeah, I think they call it July the 3rd because the idea of this formula is, unlike most herbal formulas where you have to take it for a few weeks before you start to get an effect, the idea of this formula is you can start it the day before and it should work by the day of. Now, of course, that depends on the level of panic that happens. I would say with this formula, if what your dog or cat, because these formulas can be used for cats, if what they experience is mild to moderate, then these herbs will probably work. If what they experience is more on the severe end, then probably the only thing that's going to really help them is pharmaceuticals, which it may be too late to get those. It's certainly too late to get an appointment, but
Yeah.
I know that if you were an established client of mine, and we hadn't talked about this previously, but you emailed me tomorrow and said, "Oh no, I forgot. This is coming up and I know my dog is going to have a problem. What can we do?" There are absolutely things that I would be happy to prescribe without seeing them right now, since they're already established. I've already seen them, and when someone tells me their dog panics about fireworks, I believe them because
Yeah.
why wouldn't I?
Why?
And
Yeah.
and
Why wouldn't you?
obviously that's just how it's going to be when you take your dog in. There's not going to be evidence that they're panicking.
Right.
So if you are in that situation with a severely panicking dog that you're anticipating that happening, then definitely at least reach out to your vet if you're established somewhere and see if there's something they can get you in time, even without an exam. But if that's not possible, you might still have time to be able to, for example, book an Airbnb out in the middle of nowhere.
Good idea.
Because with someone who severely panics, that's probably your next best option, is to try and get to some place where the noise will hopefully not be as bad, or at least not as constant. But if you have someone who's mild to moderate, the Herb Smith July the 3rd formula is amazing. Another thing that I have seen work for some dogs with anxiety, I don't know I've had a chance to try it with noise phobia yet, but it should work for that as well, is the CBD Calm Formula, particularly from Honest Paws, which is a combination of CBD and chamomile essential oil. And I found that to be a really powerful synergistic combination for dogs with anxiety, which, if you've listened to our conversations before about anxiety, you know that I don't typically find CBD to be very effective.
Yeah,
So this is a product that I have just stumbled across in the past several months, and I've been really impressed with it for my anxious patients.
that's amazing.
Um,
Yeah,
there's also some like custom herbals that I do that are good for this. And then there's plenty of management that you can do, making sure that they're in the best insulated room of the house, which usually is going to be a bathroom, something that's in the middle of the house rather than someplace on the walls with windows. And also no windows ideally, so they're not trying to jump through windows to escape. And then doing as much as you can to additionally insulate with blankets, pillows, whatever, pin things up on the walls to try and absorb sound as much as possible.
what was the name of the CBD that you were talking about that has the chamomile in it?
That's the Cbd Calm from Honest Paws.
Honest Paws. Okay. Lori's going to type it in. We have somebody in the
Yeah.
back helping us. So Lori will type that in. She just asked what was the name again, so she could type it in. Real quick, we have a question. My little girl had elevated liver enzymes leading to a bile acid test. Then a portal. I don't even know what that is. Can you read that? Oh, she was negative for a shunt. The next step is a liver biopsy. Is the biopsy accurate for diagnosing MVD?
Yes, it usually is. So MVD is microvascular dysplasia, which is a different kind of shunt. So when we do ultrasound or scintigraphy to look for a shunt, we're looking for large vessels that bypass the liver. With the microvascular shunt, the shunting is happening at the capillary level, so we can't see that with ultrasound or scintigraphy or anything like that. But a sufficient biopsy, which obviously if they're looking for MVD, they should take a sufficient biopsy, will show it, because when they look at the tissue, they'll be able to see if there are little loops of capillary beds that are just kind of missing the cells and not actually taking the blood into the cells. So yeah, that is actually the best way to diagnose MVD.
Is through the biopsy.
Yeah.
Okay.
Yeah.
Thank you. I hope that answered your question. Let us know. We can go further into that. My own dog, one time they thought I had the dachshund that I think ultimately, but they thought it was a liver shunt. I mean, they went down the liver shunt, did everything to try to figure out about the liver shunt. And ultimately, like I told you, it ended up being, they couldn't figure out what the seizures were. And that's why I think I always, still to this day, they thought hydrocephalus, they went down the whole list, and that poor dog went through so much to ultimately end up never being able to find out what it was, and I had to put her down, but it just was awful. But so when we talk about the 4th of July, I used to own a boarding facility, a really big one down in Newport Beach, and we took all these big dogs in, and Newport Beach has the worst fireworks ever. I can't even believe that it goes on. I feel sorry for everybody down there that lives there. It's just awful. But when we would board dogs, the first year I was there, because I was on a street with a whole bunch of boarding facilities, around 3:00 in the afternoon, the whole street went quiet. And was so naive. And I was like, oh my God, they drugged all their dogs. I can't, how is this street all of a sudden quiet? It's usually a very loud barking street because it has 14 boarding facilities on it. And so stupid me, I'm over here thinking I'm just going to wear these dogs out. And I can't believe they drugged all their dogs. Well, the next year I insisted that people bring with them a prescription, because it was the worst night these poor animals went through. I felt so bad. And this was with me and my staff holding German Shepherds. And, I'm 5'3", and I'm holding a German Shepherd in the corner all night long. It was awful. My question to you is, I found it interesting and sad, and it didn't work, so it bothered me. But when I was back working with vets, we always prescribed ACE Promozine, and it always worked. But I requested that these clients brought ACE Promozine, and instead they brought I can't remember the name of it, trazodone, and the dogs were supposed to take it like a couple of days before and lead up and did it, and it never even worked. So my question to you is, what do you think about that?
So I find trazodone is the most popular, like mild sedative. You know, if you've got someone who's wild, who's had surgery and we expect them to be wild in recovery, they'll give you trazodone to sedate them a bit so they don't ruin their surgery and hurt themselves. If they have travel anxiety, if they have noise phobia, whatever, trazodone is the most popular drug right now for all of those things, I would say. And I don't do a lot with pharmaceuticals for behavior, but I do a lot with behavior. And so a lot of my patients have come to me with a whole library of pharmaceuticals they've tried already, trazodone frequently being one of them. In my entire career, I have seen trazodone work for exactly one dog, which is a very strange, anxious patient of mine who's also extremely drug sensitive. So it works really well for her, which is great for her, but I've never seen it work for anyone else. You might take like 10% off, which if they've just had major abdominal surgery and they're young and we just need them to be a bit quiet, that might be enough. But if we're talking someone who's got anxiety, someone who's got phobia triggers, trazodone is not going to cut it. Absolutely not. Not going to do it. And in fact, part of why we've switched to using trazodone over Promozine is that there were a number of studies done by behaviorists that showed that Promozine is actually terrible for this as well, because it will sedate them, and so they look like they're fine, but there will still be incidences of things like, these poor things, incidences of things like dogs having heart attacks during thunderstorms or fireworks, even though they were on Promozine and looked completely calm at the time it happened. So Promozine does not cause heart attacks. I mean, anything's possible, but that's not something the drug is known for. And so these heart attacks are from anxiety. So the Promozine sedates them and sometimes disinhibits certain behaviors, sort of like being drunk, but it doesn't actually do anything about the anxiety. It's not an anxiolytic. So it's actually a terrible choice if what you're trying to do is help them survive and help them not feel terrible. In my opinion, the two best choices, especially for sort of spot treatment, you don't have someone who's got an ongoing psychiatric issue that you're having to treat. You just need something for this horrible few days. The two best things are alprazolam, which is Xanax, and Soleo, which is new-ish. I think it's been on the market now for probably 9 years. And actually the drug that Soleo has been around for forever. It's just the form that's newish. So I usually prescribe Xanax for my patients because I use it a lot for my anxious patients, have really good success with it, and I know my clients really well. But I know a lot of veterinarians are very anxious about prescribing controlled substances, which Xanax is a controlled substance. And so those veterinarians are much more likely to prescribe Soleo. And Soleo it's a sedative drug that, like I said, it's been around for the injectable form. It's actually one of my favorite sedative drugs because it's reversible and a lot of horrible effects. It's fairly easy for the body to process. Soleo is the form of this drug that's actually a gel that you put on the gums. So you don't have to inject anything. You just put this on the gums, and that means that it also absorbs much more quickly than most things that are tablets. It works really well for situations like this or other noise phobia situations that you may not be able to predict, like thunderstorms. It works really fast. And if it starts to wear off while the noise is still happening, you can redose and you'll get effects really fast again too. And it is an anxiolytic as well as a sedative. Both of these drugs are. So those are the two that I would recommend if you have to go the pharmaceutical route.
Yeah. And sometimes you do. And I, just like you, I am very, very holistic, but I think people lose sight of what that means. Like, basically, we care about your animal. It's not like, oh, we're holistic, so that means we're going to let your animal suffer in the corner. It's not
right. Yes.
like
no misery, no anxiety, heart attacks. That's not what we want here.
Right. Because stress is a horrible thing. You can't be healthy if you're in a constant state of stress. So we have to sometimes deal with the stress and then go from there. But the problem I had though with the trazodone is the building up to it. The two drugs that you're mentioning, are those something that you can just give once, like the day of, or is this something that needs to build up also?
So with both of them, with any of these drugs for anxiety, for what we call rescue drugs, things that aren't things you're supposed to take every day, like Paxil, for example, in humans, you might take Paxil every day for anxiety. Things that are rescue drugs like Xanax and Sileo, you don't have to build up. Ideally, you take them an hour or two before the stimulus starts. So, like with the 4th of July, if you know fireworks are going to start around, oh, who even knows, 3 o'clock, 5 o'clock, whenever
Yeah.
they start in your neighborhood, you ideally want to dose them an hour before then because we'd like the drug to start working before their anxiety gets triggered. But because these are rescue drugs, they are strong enough and designed to work in the face of anxiety, in the face of a panic attack. So if the fireworks start early or if a thunderstorm happens that you didn't know about or whatever, you can give these drugs at that time and you'll still have, maybe depending on the drug, depending on the dog, 30 minutes to an hour of things not being good and some anxiety, but then the drug should start to work and they should start to feel better. So it's not a thing where you've got to take it for a week leading up to the 4th of July or anything like that.
Are these, good question. Are these can these anxiety meds, are they pretty safe for a liver compromised dog?
They are pretty safe. I would say it depends on how compromised the liver is. If the liver is very compromised, this again is about
Right.
this thing about being holistic.
Right.
If we have someone who's got a liver that's very compromised, but who
Sorry.
also has
walking in the door. Ansel. Hold on. Sorry.
but who also has deadly severe anxiety, then it is probably best to use one of these drugs. And it might be, if the liver's severely compromised, that we just need to adjust the dosage some and not use what we would use for the normal, healthy, liver is fine kind of animal. But they are pretty gentle compared to some of the other drugs out there.
And you said that a lot of vets are nervous about prescribing controlled substances. Can you tell, like, I actually had a vet in this area where they had a drug addict who was coming in, and it's actually a really sad story. The police got involved, the girl got arrested, but she actually purposely broke a dog's leg in order to get the drugs for the dog. Do you think that's, because I'm thinking, for 4th of July, they should be able to just they don't have to give me a whole 20 days worth of it, right? You could just,
right.
You're allowed to give one pill for the dog for the night, right?
Yeah. Yes. And it's a complicated situation that involves a lot of politics, like the first thing we were talking about, the veterinary shortage.
Right.
Because we didn't used to be so sensitive about this, even though there certainly were people who were sometimes abusing dogs and otherwise diverting dogs' drugs for themselves or to sell to other people, particularly tramadol. But for a long time, we just sort of managed that in the industry. And most of us just didn't prescribe much, like huge supplies of controlled substances, unless we really knew clients well. But then the opioid crisis started to really get on the radar, and the DEA started cracking down on all prescribers. So if you are going to a human doctor and you have a lot of pain, good luck getting a controlled substance, a morphine derivative, because they just really don't hand those out anymore. In part because of the risk of becoming addicted, but also because of the risk of diversion. And in veterinary medicine, it's starting to be the same as well. The DEA first was dealing with human doctors and it got tighter there. And then they started really digging into the veterinary world and trying to train all of us that tramadol is not effective, which it absolutely is. That's not true. But just trying to convince us to stop prescribing controlled substances and to emphasize to us how much we shouldn't be prescribing controlled substances, which I think is inappropriate, but whatever, that's fine. And because of that, because of all of that energy around that, because of increased DEA sensitivity about controlled substance prescriptions, there are some veterinarians who are nervous to write too many prescriptions for controlled substances, period, because they're afraid it's going to cause some kind of flag to come up and they're going to get investigated.
Yeah.
And that may actually be true. I don't know, since I use so few drugs.
Right.
I will happily prescribe a controlled substance when I feel it's necessary, because the number of times that happens in my practice is pretty minimal.
That you need to do it. Yeah. Yeah. And I think that's the sign of a good holistic veterinarian, right? If you're teaching your clients how to feed proper foods, and you're not overdoing all the stuff that can cause these damages, right? Then you end up with clients that aren't in a huge mess all the time and needing,
Mm-hmm.
because the opioid crisis isn't just in our humans, it's our animals. I mean, I have a boarding facility. I cannot believe how many drugs, and surprisingly in Orange County, we clearly have a lot of vets that like to prescribe tramadol, because
Well, that's good. I'm glad to hear that, actually. It's way better than an NSAID.
I mean, it's good, but at the same time, they're coming with their tramadol and their crappy food, and now they have arthritis. Yeah. And so I'm like, I'm glad that the dog's not in pain, but I think the dog could also not be in pain if we would stop. He's overweight. Like, we're not addressing the problem, and it's driving me crazy. But I get a lot of tramadol dogs in. Thank God, I don't have any drug addicts working for me, because they have a smorgasbord of tramadol there. Kim has a question, but before I ask it, Kim, I'm so sorry. It sounds like you might be dealing with this with one of your dogs, so I am so sorry. I also did a podcast on this not too long ago. I really, really am just going to encourage you to listen to it, because it was all about a dog named Zoe who had mitral valve disease. Some of you may know of Zoe. Her dad was very outspoken about what he did, and actually went to both Europe and Japan to deal with mitral valve disease. So I encourage you to listen to that. But to you, Dr. Hala, can you, she's interested in if there's any meds or supplements to use or avoid for a dog that has mitral valve disease.
The stuff that I can tell you just kind of generally is, it's pretty common, I guess. Well, not all of it, maybe. Anyway, there's not a lot to avoid. Most of what we would be avoiding are things like salty foods, things like that, that unless you're feeding table scraps that you have salted for yourself, that's not really a component of a lot of things we can get for our dogs. Obviously, if you're feeding any kind of kibble, that can be pretty salty. So that is something that I would avoid, but that's neither a med nor a supplement. As far as supplements to use, there's a lot of really good ones, and a lot of them are kind of little piecemeal things. So like hawthorn berry is a really great one for heart disease. CoQ10 is really good for heart disease. But there's actually a supplement I know of that combines a whole bunch of them into one, and it is designed for dogs. It's called BioCardio, and it's from Thorne. Thorne does supplements for humans as well as for pets. And this BioCardio supplement is one I've been using for my whole career, I guess. So for a whole 12 years, it's been around the whole time, and it's been great the whole time. In the past 6 years or so, they did reformulate it into a chew as opposed to a pill. So sometimes that means there can be some allergy issues now that there's more food ingredients in there. But generally, I find it still pretty well tolerated. That's one of my favorites, and it covers all of the basics. So if what you're dealing with is not too advanced, that's probably all you need. Mitral valve disease can be anywhere from something that is super mild that never becomes a problem, they just have a bit of a leaky valve, all the way up to something that is problematic and can cause congestive heart failure. So where you're at on that journey really dictates what you need to do as far as supplements. Like I said, early in the journey, BioCardio on its own is plenty. If you're getting further along, then you're probably in a place where some custom help would be really appropriate. I do lots of Chinese herbs for my patients with heart disease, but those are all custom. As far as things to avoid, other than like food ingredient type things, there are definitely some pharmaceuticals, some meds out there that are not great for dogs with heart disease, but your veterinarian should know that. Most of them are not things that are sneaky. They're things that are well known to not be good for dogs with heart disease. So as long as you make sure that any vet that's prescribing drugs for your dog knows that they have heart disease, then you should be okay. But there's always, Google is your friend, drugs.com is your friend. Always look them up yourself as well. You know, we can be busy, and that sometimes means that we don't think things through all the way. And there's a drug that we prescribe all the time that is well tolerated in most patients, and we just prescribe it not thinking, when we should be thinking about the fact that your dog has heart disease. So it's always a good idea to double check, to just look it up and see if there's any kind of common contraindication with heart disease for any drugs that you might get.
Yeah, I just had a cat. I have a cat that's boarding with me that has cancer, and so she's on chemotherapy, and they just gave her one pill, and
Mm-hmm.
we had to give it on a particular day. Actually, it was yesterday, and that's why it's fresh in my head. And when I pulled it out, the prescription label said, make sure the capsule, like, don't open the capsule and put it on their food, right? You got to put it in their mouth. But the pill that was in there was not a capsule. It was a tablet. And so, you know, I just want to be sure, like, this cat is already compromised. I am not about to give the wrong drug to the dog, because I know that humans make errors. And so you make such a good point. And, you know, everybody wants to think that their veterinarian can never make a mistake, and the tech can never make a mistake, and the communication was perfect and everything is right. But you have to be your pet's advocate. And so Google is your friend. I love when doctors say that, because some doctors are like, oh, you Googled it. And, well, you know, sometimes Google's right. Sometimes we have to Google things, and we have to be cautious. I ended up calling the veterinarian before I gave it, and it was fine. It was the right one. It was just the label was wrong. So, which is good, but, you know, I'm not about to risk that. It was just a simple phone call. So I always encourage people to, you know, if you have questions, or, you know, they don't, mitral valve disease, make sure you say it every time. Just don't assume that your vet,
Yep.
you know, how many dogs does a vet see in a day? It could just be something that you went in for something else, and, you know, just keep talking about it. Billy, yes, Nate is amazing. I just want to go back to a comment that Billy says about Nate. He is the owner of Zoe, who had mitral valve disease, who went in and he just did so much for this little dog, and she passed away not too long ago. But she lived a good life for a very long time because of him. And he did a couple extra steps that even I, as much as an animal lover don't know that I could have done those things. I don't know, though, because I have a pretty special dog that's staring at me right now. And I'm thinking, yeah, I probably would fly to London and Japan. I probably would. But there is a lot going on with mitral valve disease. I know in the US they're trying to do some stuff. So hopefully, do you have resources in Orange County to have custom nutritionally balanced recipes for dogs? Yeah, we can talk about that. We'll do that at a different time. There are some great places that can custom make and do all of that balancing if you want to do that. But give me a call at the spa when you get a chance, and we'll talk about it. Kim says 2 dogs with early stage. Oh, 2.
And this is very interesting. So she also says no advancement in the past 2 years, and both have noise phobia. That's interesting to me, because if you watch the previous conversations that we've had on anxiety, find out that in Chinese medicine, from a root of efficiency, which means that the massy stuff, blood is not the energetic stuff, it's the physical stuff of the heart, is deficient. And most of my patients who have anxiety do not have biomedical heart disease. I have had a few where it appears that happens. And the same thing with any other sort of situation. You know, anger is often a liver thing. I have patients who have reactive aggression issues, that it's a liver problem, but they never get a biomedical problem, but sometimes they do. So I found that if we're treating it at that energetic stage, where we're just having the sort of behavioral, energetic kind of symptoms, we're less likely to get the physical symptoms. But that's why it's interesting to me that your dogs have both the energetic symptoms and the physical symptoms. And that's a little segue to say that July the 3rd, that formula we talked about from Herbsmith, it is a Chinese herbal formula, and it is focused, among other things, on tonifying the heart, building up the heart. So it's actually going to have a side effect of being good for their hearts and promoting their heart health while also helping to deal with the noise phobia. Similarly, the other thing we talked about, the CBD plus chamomile from Honest Paws, the CBD Calm, that should be completely fine for them as well. There's really no contraindication there. And CBD is super good for inflammation, which if they have, it sounds like they do not have progressive issues since they're not advanced at all. But if they are having any kind of even low grade progressive issue, there's going to be inflammation involved, and CBD is going to be helpful for that. So those would both be good choices. And you might look into, if you've got someone around you who's holistic, you might look into getting this sort of single condition with two symptoms of the noise phobia and the heart disease treated from a holistic perspective.
Yeah. Let's talk a little bit. We talked great about what to do about the anxiety, but let's talk about the after effects of anxiety. I said in the beginning of this, if your dog experiences a horrible night on 4th of July, you never were able to get any of these, nothing worked, your dog's been anxious for 2 days, and now he's got explosive diarrhea all over your house. What do we do about the after effects? Because the chances are you're not getting into your veterinarian and you're going to go down to the emergency room and hopefully get in there in 10 hours. Is there something that we can do if our dog is seemingly okay but has really bad diarrhea?
Yes. And in fact, I would say that if you have an inkling that there's going to be some kind of anxiety that might end up in a GI distress situation, you should start now or very soon with using some probiotics. You can use some bone broth, just some things that are going to help gut health and help the guts be more resilient so that if they are affected by the stress, hopefully the effect will not be as bad. And also you'll be a little bit ahead of the game on treating it. So probiotics are always great. Slippery elm or marshmallow root to help coat the guts and help deal with any irritation is helpful. My favorite first aid for diarrhea, especially quite bad, like watery diarrhea, which usually stress-related diarrhea is like that, is clay, actually. There's a product from RX Vitamins, their RX Pets line called RX Clay. I like that one, but really any bentonite clay that's intended for oral use, so like some of these detox clay kind of products that you can get at any kind of health food store, that's going to work. Some pet food stores carry it too. There's a few brands that make pet specific detox clays that you might be able to find at a pet store. It's super good and it works super well to the point that sometimes it will cause some constipation. And so you just have to be a little careful about that. That's the only real downside of using the clay. The clay really firms things up just because of its nature as clay, but it also helps to absorb any bacterial toxins. So obviously, if this happens, it would be a stress first problem, but the stress can pretty instantly affect the microbiome, and we can end up with some overgrowth of some bacteria that should not be overgrowing, and that contributes to the problem. So the clay really helps with both of those things.
Yeah.
And then just keeping them hydrated is super important if you have liquid diarrhea, especially if you are not going to be able to get into your vet, which is very likely the situation. Using bone broth, coconut water because of the electrolytes in it. And of course, it's got a little bit of sugar too, which can help the guts. Anything really, if you've got to mix some broth in with coconut water or broth in with plain water to get them to drink more, make a gruel with their food by adding more water to it, ideally warm water if you're going to put it in their food. Those things will all help keep them hydrated, which is the main serious problem with diarrhea. And I know that with stress-based diarrhea, it can be really dramatic with blood and all kinds of scary things. If the blood is bright red, it's less scary because that means they probably don't have an ulcer. It's probably just irritated large intestine that is bleeding, which can be very dramatic and can potentially be problematic even. But I've seen some really bad hemorrhagic gastroenteritis that was just blood pouring out, really. And those dogs did not have a problem because of the blood loss. They had some other issues we had to deal with, but the blood loss was not a major thing.
Yeah.
And clay instead of pumpkin. Pumpkin is great as well. I just find that clay tends to work faster and more dramatically. So if you had just some soft stools, maybe a little bit of cow pie diarrhea, pumpkin might be fine. But if you're having super horrible liquid blowout, potentially bloody, which is frequently what is happening after these stress events, the clay is probably going to be a better bet than pumpkin.
That's why the vets get so inundated on July 5th, because it's
Mm-hmm.
bloody, watery, panicked, diarrhea all over your furniture in your house.
Yeah.
I don't know how you feel about this, but my two dogs I have right now are fine, but I actually don't feed them the July 3rd.
Mm-hmm.
So
Yeah.
I give them a lot of liquids July 3rd. They'll get bone broth, those kind of things. And then the day of July 4th, I'll give them bone broth, but I just don't, it's just not something I want to make a bigger problem. So I have suggested to people, as long as you don't have a puppy or a diabetic animal or those kind of things, maybe just don't feed them on July 4th, so that July 5th, they're not blowing out all over the house. So, and keep them hydrated. So I just usually will just put down a bowl of bone broth for the day, and that's what they'll have. That helps. That helps. Um,
That's totally acceptable. And in fact, when you're stressed, your guts can't really process anything anyway.
okay.
So you may as well not have anything in there. Just, yeah, if you have any medical issues, make sure that you clear that fasting is going to be okay with the medical issues. And do not do this for cats. Every time
Oh, yeah.
fasting comes up, I always put that out there because
Don't
fasting
fast
can be
cats.
life-threatening for cats. So make sure you do not fast your cats, but your dog's totally fine.
Thank you. Thank you. I am so glad that we talked about that, because I know it's going to happen. I'm really fortunate. I don't know about other boarding facilities, but I'm going to throw out another suggestion. And not that I'm trying to, believe me, I'm already booked for 4th of July. But I board a lot of dogs on 4th of July, because where I am, we can't hear any fireworks. It is amazing. Like, I'll even take my dogs down there because we just hear nothing. I'm in an industrial park. We're not by anything. So I would also suggest, if you can, find a boarding facility that you're sure. Now, don't just go board your dog there, because that could be another type of anxiety. But if you have a boarding facility in your area that doesn't, is maybe in an industrial area that they can't hear the fireworks, that's another option. A good friend of mine drives, she literally loads her car up and drives around for hours with her animals in the car with the music playing,
Mm-hmm.
which that is dedication. But she does it because she doesn't want to drug them, and she has one dog that is just horrified. So there's some other options you can do if you can't, like Dr. Hollow was saying, it may be too late for you to get a prescription. Sometimes well, first off, you have to have, which makes sense, you have to have a relationship with your veterinarian. They need to know that your dog is healthy enough to be prescribed that stuff. So this has just been, I'm glad that we came on. I'm glad that we talked about 4th of July. I hate to see, every year I find out some of my clients have went to the emergency room on July 5th and spent a bazillion dollars trying to find out. And that always makes me mad, because I feel like the vets should go, well, this is probably just, everything else is fine. But instead, you can get up to the wrong vet, and next thing you know, they run every test known to man on July 5th to find out nothing's wrong with your dog. But so you got to be careful. So thank you. Thank you. We're coming up on our hour. I try really hard to keep you guys so I don't overextend your time, because you guys are just such a blessing. For those of you who are watching and don't know, I called it Vets I Recommend, not because I just bring on any vet. It's literally vets I would bring my own dogs to, my own cats to. And I'm pretty, my own reasoning behind that is they're not just holistic, because I don't look for somebody who doesn't, like, I love that you're saying, look, if your dog is under a lot of stress, you might have to get pharmaceuticals, and that's okay. But we should always try some other things. It's hard at 4th of July, right? Especially if you have a puppy
Yeah.
who you don't even know. And you're like, oh,
Mm-hmm.
well, what if you have no idea your first 4th of July, what's going to happen? So maybe test your dog ahead of time and see how he does with sound. That might be a little indication. So um,
And
I
if you have a puppy who has never had a 4th of July before, I was very lucky with my puppy, but had I not been, had he started to show signs of anxiety, I would have done everything I could to encourage him to be calm and then reward him when he was even
Oh yeah.
2% calmer than when I asked him to calm down, however it was I asked him to calm down. So if it is your first 4th of July with a puppy and they are a bit nervous, just try to make it as positive of an experience as possible, because that will help to build them some tolerance to the noise, instead of making it a traumatic event, which then means every year is going to be worse. Oh, and I just want to mention this, since I had mentioned if last year was good and your dog hasn't had noise trauma, maybe they'll be good again. But then it occurred to me, I have trouble with fireworks, and the reason I have trouble with fireworks is from noise unrelated PTSD. Everyone with PTSD hates fireworks, and it doesn't matter if you were never on active duty and hearing explosions. It doesn't matter if there were no sounds involved with your trauma. PTSD makes you just hypervigilant, which means that loud noises can be very problematic. So if you know that your dog has trauma, PTSD from something unrelated to noise, whether that's something new this year or not, know that they are more likely to be upset by the fireworks.
That's a good point. I hadn't even like considered that. Yeah. Yeah. It's hard with puppies. Such a good point, because you can make or break, right? You can make or break
Mm-hmm.
for the rest of this dog's life, depending on how you react to it. So, I know you're a veterinarian and not a dog trainer, but what great dog training tip right there she just gave you guys for free. When your dog is calm, you give the treat. You don't sit there while he's in anxious mood and try to shove food down his throat. So,
That's right. We want to shape the behavior we want. So
yeah,
again, even if they're 2% calmer, they just need to be a little bit calmer, and then they get the reward, whatever,
yeah,
whether it's a treat or a pet or a toy or whatever.
yeah. That's some great dog training tips right there from your veterinarian. So, all right, guys, we're going to go ahead. Thank you so much for all of your questions. It matters. It helps us educate everybody. As Dr. Hala and I were talking about, veterinarians are inundated right now. It's hard for you to get in there. So the more that we can help you be able to do something on your own, like if your dog has diarrhea on July 5th, she just gave you some great tips on some things you can do, because you don't want to be waiting in that line. So just be careful with that stuff. Dr. Hala, thank you so much. I wish I could come up with something better than thank you, because I know you just do this for free and it's out of the kindness of your heart, and just your love for animals is just such a blessing to have you be able to discuss and take the time to do this. So thank you so much.
You're so welcome.
You're just amazing. I can't wait to see you next time. Lori is behind the scenes. Without her, you would not have all of this lovely information that she types in for you so quick, because I would be still sitting here like pecking away at my computer trying to do it. So Lori, thank you so much. And for you guys, thank you for joining us every week. And I'm just excited to be here and help educate you guys as well. So, all right, everybody, have a wonderful evening.